Yeah. Hello. Good evening, doctors. Voice audible? Okay, good evening, very good evening, very good evening. Okay, so let us start demo session on pharmacology. Okay, very good evening, very good evening. A small topic, a sample topic called anti-anginal agents I am going to discuss. So, to start, so today demo session is on anti-anginal agents. First of all, angina means chest pain due to vascular etiology. For example, there is a coronary artery disease. There is a problem in the coronary artery that causing severe chest pain. That is called angina. So, angina means pain due to vascular etiology. So, here anti-anginal agents I am going to cover. What are they? First of all, there are three different types of angina. Look at type. I just go little bit basic and then come into pharmacology. There are three different types of angina, namely stable angina, number 2 unstable angina, and number 3 vasospastic angina. So there are three different type of angina. What is stable angina? As the name indicates, here the patient going to tell complaining of chest pain only on exertion. That is, when you go for walking or when you go for jogging or when you do some exercise, at the time of exertion alone he developing chest pain, and the chest pain is completely relieved by taking rest. The pain is completely relieved by taking rest. That's called stable angina. Okay. Whereas what is unstable? Unstable means here the patient going to tell complaint of chest pain, but he say, sir, I don't know when I am going to develop chest pain, sir. I don't know. Even during resting time, even during sleeping time, I may develop chest pain. That's called unstable angina. It is a dangerous because this patient at any time may land on acute myocardial infarction. It may land on acute myocardial infarction. So, it is dangerous. And then coming to one more thing called vasospastic angina. Look here. What is vasospastic angina? Look here. As the name indicates, there is a sudden vasoconstriction, sudden vasospasm that may cause reduction of coronary blood supply, causing chest pain. Here, there is no atheromatous obstruction. Sudden vasospasm causing chest pain, that is called vasospastic angina. Like the three different type of angina. When you talk about anti-anginal agent, you should know what is the fundamental pathology causing angina. If we know the pathology, and it's very simple to proceed to pharmacology. Look at what is the pathology. Very simple, very simple. Look here. Imagine it's a coronary artery. As age advances, as age advances, or due to hypertension, or due to diabetes, or due to high cholesterol problem. Look here. Because of this risk factor or because of smoking, what happened? As age advances, there is atheromatous sclerosis. There is atherosclerosis. There is this atheromatous plaque. Look at this atheromatous plaque obstructing the coronary artery. Because of obstructing the coronary artery, look here, there is reduction of blood supply to the myocardium. That reduction of blood supply, come on, whenever there is a reduction of blood supply, the nerve endings are crying for oxygen, the crying of nerve ending causing chest pain. So, one of the main reason for chest pain in angina is due to reduction of coronary oxygen supply or reduction of blood supply. That's one. The another reason is, look here, this amount of blood supply may be enough when the patient is taking rest. But the same patient, come on, when you go for walking or jogging, at the time of walking or jogging, the heart rate is very fast. Here, the cardiac workload is very high. When the workload is very high, means there may be more oxygen demands. When there is increased oxygen demand, this atheromatous coronary artery may not be able to produce that much amount of oxygen supply. So, one of the reason is increased oxygen demand. That main, coming to my point, there are two major reasons causing angina. One main reason is reduction of oxygen supply. Another reason is there is an increase in oxygen demand. Now, I want to ask a question. Come on, all of you please answer. Nitin, Shreya and other. There are, and I don't able to understand name. So, please, all of you, please answer me. Come on. If we want to treat a case of angina, come on. If we want to treat a case of angina, what are the two things can be done? One thing is, we can increase oxygen supply to the heart. We can increase oxygen supply to the heart, or one more thing, we can reduce oxygen demand of the heart. We can reduce demand of the oxygen. Okay, now, come on. If you want to increase oxygen supply, you need what? Come on, already Shreya was answered. Good. If you want to increase oxygen supply, you need vasodilator. Once again, if you want to decrease oxygen demand, you need, come on, you need cardiac depressants you want. Fantastic. All are answering very nicely. Good, beautiful. That means, when you want to talk about angina, the anti-anginal drugs are classified into two categories. One group is called vasodilator. The second group is called cardiac depressant. Please note the point. The two important group of anti-anginal drugs are, one is vasodilator, one more thing, cardiac depressant. Now, coming to vasodilator, in this category, what are the main group? In vasodilator, one of the main group is nitrates. Nitrates are very important group of anti-anginal agent, comes under vasodilator. The another category, potassium channel opener. Now, I want to ask one question to Shreya Singh and Shubman Nandu. Can you please answer one simple point? There are lot of potassium openers are there. Can you please answer, anybody? Name one very important potassium opener useful for treatment of angina. We have lot of examples. They are useful for hypertension. But my question, the answer is good. Nicorandil. Fantastic. A potassium opener useful for treatment of angina, nicorandil. Good. And coming to cardiac depressant, in cardiac depressant category, number one, we have the most important group of drug called beta blocker. Very important. Beta blockers are very important first line drug, superb drug, they life-saving drug, disease modifying drug in case of treatment angina. Fantastic drug. Okay. Then another group of drug having both vasodilatory action as well as cardiac depression action. That group of drugs are called as calcium channel blocker, simply called CCBs, calcium channel blocker. Okay. And then, other than this four major category, we also have some more important group of drug useful for treatment angina. What are they? Number one, we have ivabradine. What is ivabradine? Ivabradine is a funny current sodium channel blocker. That is called ivabradine. And then we have one more group, trimetazidine and ranolazine. Both are antioxidant. Both these are antioxidant useful for treatment of angina. Antioxidant. They also call pathway of fatty acid oxidation inhibitors. They call pathway FO mean fatty acid oxidation inhibitor. They call antioxidant. Good. So the other important group of drug useful for treatment of angina mean ivabradine. Ivabradine is a funny current sodium channel blocker, and then trimetazidine, ranolazine, they call antioxidant. They also call funny current sodium channel blocker. Okay. So the outline of anti-anginal mean we have nitrate group of drug, we have beta blocker, we have CCB, and we have potassium opener like nicorandil, and then ivabradine is a sodium blocker, and trimetazidine, ranolazine, they are called antioxidant, the so-called pathway of fatty acid oxidation inhibitor. It's an outline. Now, today as a demo session, we go for discussion of one very important drug called nitrate group of drug. So, actually in my regular class, I will go one by one proper discussion. Each and everything I will cover in my regular session. Okay. So, today as a demo, I just go through nitrates in the treatment of angina. So, put the title, my first topic today as a demo session, put nitrates. Now, whenever in my class, I go from basic to high level. So, basic means what are all the drug available, what is the physiology, what is the mechanism, like that, and then clinical aspect, then integrated clinical points. So, go from basic to high level. So, look here first, nitrate. What are all the available nitrates? For example, based on duration action, based on duration of action, we are classifying nitrate into short-acting nitrate. Number 2, intermediate acting nitrate. Number 3, longer acting nitrate. And number 4, longest acting nitrate. Like that, we are classifying nitrate into 4 important classes based on duration action. Now, just go through. What are the examples for short acting? For example, glyceryl trinitrate and amyl nitrate. Look here, the glyceryl trinitrate can be called GTN. Glyceryl trinitrate. It is also called as NTG, nitroglycerin. Either you can call this as GTN or you can call this as NTG. NTG means nitroglycerin, both are same only. And one more thing is amyl nitrate, both are short acting. Then look at this intermediate acting agent. For example, isosorbate dinitrate. We simply call this as ISDN. That means isosorbate dinitrate. It's an intermediate acting agent. Very important. And then we have longer acting drug. For example, isosorbate mononitrate. This is MCQ. Please note. Isosorbate mononitrate. It is simply called ISMN. That is isosorbate. MN means mononitrate. Here one question to Shubham Patachari and Gushbu Nandi Shreya. Can you please answer? Actually speaking, what is isosorbate mononitrate? Can you please answer, doctor? What is isosorbate mononitrate? The answer is, it is actually an active metabolite of ISDN. This is MCQ. Please note. What is ISMN? ISMN is a very good one. Anima Anamika, very good, Anamika, very good. It is a metabolite of isosorbate dinitrate. Remember, isosorbate mononitrate is the active metabolite of ISDN, isosorbate dinitrate. This one you should know, okay? And then longest acting. The longest acting nitrate preparation is penta-erythritol tetranitrate. Penta-erythritol tetranitrate. Okay. This is what classification of nitrate based on duration action. This is a fundamental basic slide. Because in my regular class, some foundation students may attend. For them to revise the knowledge, I go for this. Now, very important thing I am going to ask. I am going to ask 3 important questions. Both are old questions from NEET paper and AIIMS paper. So, please try to answer. If you are not answering, I will explain. Okay. Now, first question, look at the question. Can you please answer? Suppose a patient developed chest pain. That too, coronary artery chest pain. The question. For rapid relief of chest pain in case of acute attack of angina or in a case of acute attack MI, can you please answer which nitrate you want to use? The question is very simple. For rapid relief of pain, patient having acute chest pain due to heart attack or due to angina. In acute angina, you want to go for very good, short acting drug like nitroglycerin. Very fantastic. All are answering very beautifully good. So I go for short acting nitrate preparation. Short acting drug like nitroglycerin or isosorbate dinitrate. Either you can use nitroglycerin or you can use isosorbate dinitrate. It's short acting drug. Okay. In that, somebody already answering, they given for rapid relief of chest pain, they given sublingually. This also you mentioned in your chat box. Very good. My question starts because look at all nitrate when I give orally, nitrates when I give orally, they undergo very high first pass metabolism. Because of this problem, to avoid this problem, we give nitrate sublingually for rapid action. But my question starts, come on, it's very interactive. I know all nitrate when I give orally, they undergo high first pass metabolism. But my question is, which is the nitrate? Come on, which is the nitrate even on oral route undergo least first pass metabolism? Come on, which is the nitrate undergo least first pass metabolism? In answer is isosorbate mononitrate. This you should know. It is old MCQ. Please remember which is the nitrate even on oral route undergo least first pass metabolism. In answer isosorbate mononitrate. This is important. Okay. Another question, very important AIIMS question. Look here. You told that for rapid action, give the nitrate sublingually. You are right. But my question for AIIMS paper, come on. If we give sublingually for rapid absorption, can you please answer? For rapid absorption, the sublingual nitrate should have some property. Come on. In your general pharmacology, you may be studied for a drug to get rapid absorption. It should have some property. What are they? Answer. They should be highly lipid soluble and they should be non-ionized. Fantastic, ma. Everybody answering very fantastically. I feel so happy. So, next question. For rapid action, the sublingually given nitrate should have either lipid soluble property or non-ionized property. Then only it may go for rapid absorption. Fantastic. Good. And finally, one more question. Look here. Majority of nitrate may cause one important side effect called skin rash. Skin rashes are common side effect. Maybe allergic reaction may cause skin rash. But my question, which is the nitrate may cause very high chances of skin rash? Which nitrate may cause high risk of skin rash? Mean answer penta-erythritol tetranitrate. It's also old MCQ. Which is the nitrate preparation may have high chances of causing skin rash problem in penta, erythritol, tetranitrate. So this is one MCQ. It is second MCQ. It is AIIMS question. It is a fourth question, world NEET question. So in this slide, I covered 4 important world question. Okay. Now I go for fantastic next question. That question is, look here. We are discussing nitrates are useful for treatment of angina. Now what I am going to cover, this is what very essential point, going to cover mechanism of actions of nitrate. Okay. In pharmacology, when you talk about any drug, you should know basic mechanism, because once you know mechanism, action simple. Once you know action, you can use a simple. Once you know action, adverse effect simple. So to understand the pharmacology, you need a good basic knowledge. Now I go for mechanism action. Look here. Whatever nitrate, either short acting or long acting or longest acting, whatever nitrate, the nitrates are first point acting on cysteine receptor. So point 1, nitrate acting on cysteine receptor. That means you should know target. What is the target in which nitrate acting on? Answer, the target is cysteine. Okay. Once a nitrate acts on cysteine receptor, what it does? Once acting on cysteine receptor, the nitrate going to cause release of nitric oxide. They causes release of nitric oxide. NO mean nitric oxide. Note the point. Nitric oxide. That is second point. Okay. Now the third point, physiology point. Look here. Once there is a release of nitric oxide, what it does? This nitric oxide going to cause activation of one enzyme called guanylyl cyclase. They cause activation of one enzyme called as guanylyl cyclase. That is third point. Once there is a release of nitric oxide, they are going to activate guanylyl cyclase. Now the last point. Once a guanylyl cycle is activated, it going to cause accumulation of cyclic GMP. The cyclic GMP is the second messenger. The cyclic GMP having the property of smooth muscle relaxation. It causes smooth muscle relaxation. Smooth muscle mean, whenever in pharmacology, smooth muscle mean, always think of vascular smooth muscle and visceral smooth muscle. So look here, the cyclic GMP having the property of smooth muscle relaxation. That means they are going to relax us vascular muscle and visceral muscle. That means they are going to cause vasodilatation. That's all. Now I have discussed the mechanism action. Now what is necessary for you to appear for entrance exam? The answer is, look here. First MC question, look here. Nitrate acting on which receptor? The target is MCQ. The target is cysteine. So first MCQ, what is the target in which nitrate acting on? Cysteine. That is first question. The second MCQ question, nitrates are ultimately acting by accumulating what as a second messenger? Cyclic GMP. This is second MC question. Nitrates are acting by accumulating what as a second messenger? Answer is cyclic GMP. The cyclic GMP is the one second messenger causing vasodilatation. That's about mechanism action. Now I want to discuss some extra point. Now if you answer my extra points question, you are the best student. Okay. Now first question, look here. Nitrates are causing vasodilatation by accumulating cyclic GMP. For that, nitrate releases nitric oxide. The release of nitric oxide going to activate guanylyl cyclase. That means nitric oxide acting by releasing nitric oxide. Okay. Now I want to talk extra points. Put the title extra point. I want to talk about 3 important extra points. My first extra point, based on this slide, I want to talk 3 extra points. First question, anybody? Name some drug, man. Name some drug which are nitric oxide independent direct guanyl cyclase activator. Look here. Nitric oxide activating guanyl cyclase by the help of nitric oxide. But my extra question is, there are some drug without the help of nitric oxide directly activating. Yes, good. Shubha, Gundu, Gushpu. Yeah, very good. Look, Riociguat, Chinociguat, very fantastic. Please note, doctor, Riociguat, one more drug, Chinociguat. So, these are direct guanyl cyclase activator. Nitric oxide independent. What is it about? Nitric independent direct guanyl cyclase activator. And can you please answer one more point, because the interactive session, you must interact with me. Come on. These Riociguat, Chinociguat are very wonderful vasodilator, going to be useful for treatment of what condition? Useful for treatment of primary pulmonary hypertension. Note the point. Riociguat, Chinociguats are direct guanyl cyclase activator causing vasodilatation, approved for treatment of pulmonary hypertension, useful for pulmonary. In this area, come on. In this area, I am going to ask one wonderful question. Come on. If you answer this question, you are the too good. You are the best in whole India. Can you please answer? The Riociguat, Chinociguat, useful for pulmonary hypertension. I do agree. But I want to ask one latest point. Can you please answer? Name one latest direct guanyl cyclase activator approved for treatment of congestive cardiac failure. Can you please answer, anybody? Name some nitric oxide independent direct guanyl cyclase activator approved for treatment of heart failure. That answer is Vericiguat. Please note, latest point after latest point, expected MCQ for this year. Remember. Vericiguat is the direct guanyl cyclase activator, useful for congestive cardiac failure. Latest point. Okay. So, one of the extra point I told is nitric oxide independent direct guanyl cyclase. Come on, Javed Absan. You told sacubitril. That is different, Dr. Javed. Sacubitril something different. Equidotril, sacubitrils are neprilysin enzyme blocker. We have one thing called neutral enteropeptidase. They call neprilysin. For example, we have brain natriuretic peptide analog called neseritide. The neseritide undergo metabolism by vasopeptidase. That is blocked by sacubitril. Come on, Javed. That is different topic. Come on, medicoaspirin. Sildenafil, that's also different. So don't confuse, man. The direct guanyl cyclase activator, useful for treatment of congestive cardiac failure. Mean the answer is Vericiguat. Okay. Now coming to another beautiful extra point. Come on, I am talking extra point, doctor. This is what you need. Those who have finished final year, those who have finished house agency, those who are ready for exam, they need extra point only. For them, it's a very good treat. Come on. First extra point. Cyclic GMP, I told, having vasodilatory property. Now, one wonderful point I want to tell you. That point is, look here. The cyclic GMP generally undergo inactivation or undergo metabolism by one enzyme called phosphodiesterase 5 enzyme. Look here. Cyclic GMP, we know, having vasodilatory property. But this is undergo inactivation, that is undergo metabolism by PD5 enzyme. Now, wonderful question. Look here. When cyclic GMP undergo metabolism by PD5 mean, come on, doctor, if I want to have vasodilatation, I should maintain, I should accumulate cyclic GMP. For that, I should inhibit PD5. Now tell me, name some selective PD5 blocker. Come on. Name some selective PDE5 PDE5 blocker name? Come on, sir. That is sildenafil. Okay. So sildenafil is a selective PDE5 blocker. That's important, very important. So here, direct guanyl cyclase activator mean riociguat, chinosiguat, useful for pulmonary hypertension. A new drug, vericiguat is a newer drug, that is a direct guanyl cyclase activator useful for treatment of heart failure. And then PDE5 blocker means sildenafil, that is inhibiting PDE5 enzyme. Okay, in this case, one more thing, very interesting question. Come on, Akhilesh, medicoaspirin, and come on, look at this point. Look here, nitrates are acting by accumulating cycle GMP, thereby nitrate causing vasodilatation. And now we are discussing sildenafil, a PDE5 blocker acting by accumulating cycle GMP. So this also causing vasodilatation. Now, wonderful point I want to tell you. That wonderful point is, look here. Suppose a person, look here. Suppose a person taking nitrates tablets plus sildenafil tablets. Look here, sildenafil. Look here. Suppose a patient taking concurrently nitrate and sildenafil. Both the drugs are acting by accumulating cycle GMP. When both are accumulating cycle GMP, both are causing vasodilatation. They may cause severe hypotensive shock. That means a recently asked NEET question. Please remember, nitrate should never given, MCQ, should never given with sildenafil. Concurrent use of nitrate and sildenafil causing severe hypotensive shock. So dangerous. So the recently asked NEET question, nitrate should not be given with the what drug? Answer is sildenafil, because concurrent use of these two drugs may cause severe hypotensive shock. That's about second important extra point. The last one more extra point, look here, we are talking about extra point. The last one more extra point I want to tell you, look here. Nitrate, I told, acting on the target. The target of nitrate is the acting on cysteine receptor. Now, one wonderful question, basic concept question. The concept is, look here. Suppose if I keep on giving nitrates, look here, if I give continuously, come on, if I give continuously nitrate, as a infusion, as a patch form, if I continuously delivering nitrate mean, look here, if the receptor continuously exposing the drug mean, the receptor will go for down regulation. Now question starts. When the receptor go for down regulation, when you give nitrate, there may not be action. That is called development of tolerance. This is important. Development of tolerance. So look here. One of the problem of nitrate is development of tolerance. So tolerance means to get the same action, the drug need more dose. What do you mean by tolerance? To get the same action, they need more dose. That's called tolerance. Why tolerance mean? It is due to down regulation of receptor. Why down regulation mean? It is due to continuous exposure. Whenever a receptor, continuously exposed into a drug mean, the receptor will go for down regulation. Okay, and one more last question. When will be the receptor go for down regulation? Continuous therapy. When you are giving continuously, for example, if we give intravenous infusions of nitrate, when you give IV infusion, or when I give transdermal patch, transdermal routes, in these routes, nitrates are continuously delivered. Because of continuous delivery, there is a down regulation of receptor, thereby the drug may develop resistant, that's called tolerance. Okay, and finally one more point, we know sildenafil, a PDE5 inhibitor, it's a vasodilator. Of course, you should know Sildenafil normally useful for treatment of erectile dysfunction. I put ED. ED mean erectile dysfunction. One more thing, useful for pulmonary hypertension. Okay. Okay. So question. Sildenafil, a PDE5 blocker, useful for erectile dysfunction and for pulmonary hypertension. So all these are wonderful extra point. You should know point. Okay. Now ultimate take home message in this slide regarding my chapter. My chapter is nitrate. In that, what are the take home message? Apart from extra point, the straight point take home message point. Nitrates. Point 1, acting on cysteine receptor. Point 2, releases nitric oxide. This is going to activate guanylyl cyclase enzyme, thereby causing accumulation of cyclic GMP, that causing smooth muscle relaxation. Okay, that's all. Now, this is the mechanism action. Now, based on the mechanism action, I want to study action. So, next point, I am going to discuss actions of nitrate. Actions of nitrate. For that, you should know nitrate having smooth muscle relaxation property. And smooth muscle mean we are dividing into vascular and visceral. So, when we talk about action, we go one by one. First, we go for visceral smooth muscle action. What are you getting? Actions of nitrates. In that, first we go for actions on visceral muscle. Okay. Now question, what are all the visceral smooth muscle relaxed by nitrate? We go point by point. First muscle, come on, biliary smooth muscle. Here you must know point actually. Look at this. This is called biliary muscle. Gallbladder, bile duct, it's a biliary smooth muscle. So, the first muscle you should know, biliary smooth muscle undergo relaxation by using nitrate. Come on. Because of relaxing biliary muscle, what is the use? What the use? Because of relaxing biliary, it can be useful for biliary colic pain. That is, look here, sometimes the stone, gallstone from the bladder may come out and causing obstruction of common bile ducts. When it causes obstruction, that is causing colic pain, constriction pain. For relieving the colic pain, we can try nitrate tablets. That's one point. Second, the another visceral muscle relaxed by nitrate is esophagus. So, point 2, esophagus. Look here, the esophagus smooth muscle relaxed by nitrate. Because of this, what is the advantage? Look here, there is one condition called lower esophageal spasm. This is called achalasia cardia. Achalasia cardia. Okay, achalasia cardia means lower esophageal spasm. There is a difficulty in swallowing. For treating this case, we can use nitrate. And finally, nitrate also able to relax the bronchus. Look here. Nitrate also able to relax bronchus. Because of this property, it can be safe. It can be safe even in bronchial asthma patient also. See, actually it is not useful for treating asthma. It is safe even in asthmatic patient. Even in asthmatic patient. Okay. Now, look here, when you talk about visceral muscle, one very important point. What is the important muscle which are not relaxed? This is important. This is MCQ. This is MCQ. Please note, nitrates do not have significant action on ureter muscle. So, ureter smooth muscle is not getting relaxed by nitrate. So, nitrate not useful for treatment of uretery colic pain. This is important, very important. Nitrates not used for treating uretery colic pain because nitrate do not have significant action on ureter muscle. So, nitrate not useful for treatment of uretery colic pain. So, here nitrate useful only for biliary colic pain. This point important. They are not used for urinary colic. This is very important, okay? And then we finish visceral. Now coming to vascular. Come on, we are talking actions of nitrate. Next we go for action on vascular smooth muscle. This is what most important cardiology. So please listen, Vascular. Actually, we know nitrates are vasodilator. That point is very simple because they are accumulating cyclic GMP, that we know. But today you should know, in cardiology, if a drug is a vasodilator, it may be maximally dilating artery, some drug maximally dilating vein, some are equally dilating artery and vein. Now, what about nitrates? Please note, nitrates are predominantly, nitrates are predominantly venodilator. They also dilate artery. I do agree. Nitrate also dilating artery, but maximally dilating vein. Now look at the point. Because of predominant venodilatation, look at the picture. The inferior vena cava getting dilated, thereby causing peripheral pooling of blood. Peripheral pooling. Now question. Because of peripheral pooling, the venous return get reduced. The venous return is reduced. Come on. Venous return reduced. The venous return is the one causing preload. So, nitrate maximally reduces preload. Note the point. First point. Nitrate maximally reduces preload. This point, very important point actually. Because of venodilatation, peripheral pooling of blood, thereby reduction of venous return. The venous return is called preload. So, maximally reducing preload. Point two, nitrates also dilating artery, but minimally dilating artery. So, when artery undergo dilatation, there may be reduction of peripheral arterial resistance. Peripheral arterial resistance. It is called as afterload. Okay. So, because of dilating artery, there is a reduction of peripheral arterial resistance, thereby nitrate causing minimal reduction of afterload. So, point 2, minimal reduction of afterload also. Look. Nitrate maximally reducing preload, minimally reducing afterload. Now work out. When preload, afterload, when both the loads are decreased, mean the total cardiac workload. Come on, total cardiac workload is decreases. Okay. When preload after decrease, mean the total cardiac workload decrease. Now please answer. Come on. Shubha, Gundu, Akhilesh, all my dear students, can you please answer? When total cardiac workload decrease, mean, can you please answer what happened to oxygen demand? When I give nitrate decreases total cardiac workload, mean what happened to oxygen demand? Oxygen demand is getting decreases. So, nitrate reduces oxygen demand. By decreasing oxygen demand, nitrate relieves angina. So, the take home message, come on, take home message, nitrates relieves angina mainly by reducing oxygen demand. This is MCQ, important question. Nitrate relieve angina mainly by reducing oxygen demand. Okay, that's about vascular action. And I want to tell one more important action that is difficult to understand. If you understand, you are too good in pharmacology. Come on, try to understand. That is, when you talk about vascular actions of nitrate, one more important point you should note down. That point is, look here. Imagine it's a myocardium. Imagine it's a coronary artery. We know nitrates are vasodilator. Now question starts, when I give nitrate, what happened to cardiac blood supply? What happened to cardiac blood supply? Look here, already Subha Gundu answering. Read this property. Wow, beautiful Subha Gundu. Very fantastic, very fantastic. Now look here, I am going to explain what happened to cardiac blood supply by using nitrate. Write the point first and then I will explain. Look here, nitrate causes redistribution of blood flow from non-ischemic to ischemic area. So, point 1 doctor, look here, nitrate causes redistribution of blood flow from non-ischemic to ischemic area. And one more point, nitrate do not increases blood supply all over the myocardium. They do not increase blood supply all over myocardium. They mainly increasing blood supply only to the ischemic area, only to the infarct area. That's called redistribution property. Redistribution property. Okay. If we know this is more than enough, but for getting a very good knowledge, I go how this redistribution happening. To understand this very difficult, I will try to explain, try to understand how nitrate causing redistribution of blood flow. Look at the explanation. Look here. First, I have 3 model A, B, C. 3 model. What you should do, just to look at the control. Look at this. Just look at this photo alone. Look at this middle photo alone. It's a normal. For example, a control for you and for me. What happened? Look here. Imagine it's a coronary artery. Imagine. Okay. This is a branch, one branch, another branch. Look here. Here I put one atheromatous block obstructing one branch of coronary artery. Because of the obstruction, look at this. This area blood supply is getting decreases. This is a normal branch having normal amount of blood supply. Okay. But one point, doctor, you may be studying physiology, the artery and all ending as arteriole. Ending as arteriole. And the artery may be connected here by collateral circulation. This is normal physiology. Now, look at the control. Look at control. Imagine, whenever there is a obstruction in one branch of coronary artery, there will be reduction of blood supply to that area. The other area will receive normal amount of blood supply. Okay. Now, the question is, look here. Whenever there is obstruction, naturally, that is physiologically, whenever there is obstruction, to compensate the ischemia, distal to the obstruction, the arteriole are trying for dilatation. Okay. So, normally, physiologically, whenever there is obstruction, there is ischemia. So, to compensate the ischemia, physiologically, distal to the obstruction, the arterioles are undergo full dilatation, thereby trying to give extra blood supply. It's called compensation. But look at these arterioles are maintaining normal tone. It is physiology. Now coming to my pharmacology. For this patient, this obstruction, for this patient, imagine if I give nitrate, what will happen? See, nitrates are vasodilator, but one super point is nitrates are mainly going to dilate collaterals. Note the point? Nitrates are mainly dilating collateral. Because of collaterals dilated, look at this portion was already dilated due to physiology. When the collateral dilated, some extra blood may go this way, and because of already dilated, some extra blood go to the ischemic area. But this area will receive normal amount of blood supply. This is called redistribution of blood from non-ischemic to ischemic area. The answer is collateral dilatation. Okay. And finally, one more question you should know. Look here. For this patient, imagine if I give one drug called dipyridamole. Come on, we have one drug called dipyridamole. If we give dipyridamole, it's a very old drug. If we give this drug, what happened? The dipyridamole having the property of dilating arterioles. Now look here. If this is going to dilate arterioles mean, look here, this arteriole was already dilated. If I give dipyridamole, this normal arterioles, the normal arterioles also go for dilatation. When this goes for dilatation, there is unnecessarily increasing blood to normal area. It's not needed. Unnecessarily we are increasing blood to normal area. This is called as what? Can you please answer? This is called as, very good, it's called as coronary steal phenomena. Coronary steal phenomena. It is old question. Coronary steal phenomena seen with the what drug? Answer dipyridamole. Dipyridamole causing this. Anyway, doctor, take a message. Nitrate causes redistribution of blood from non-ischemic to ischemic area. That's all, man. So we finish actions on visceral vessel, actions on vascular. Based on action, we go for nitrate uses. Come on, uses. When you say uses, divide them into cardiac use and non-cardiac use. First, cardiac use. In cardiology, nitrate useful for treatment of number 1, angina. Number 2, MI. Number 3, congestive cardiac failure. So remember, useful for treatment of angina, useful for treatment of myocardial infarction, useful for treatment of heart failure, and also in case of hypertension also. In case of hypertension also we can try nitrates. Okay, that's about cardiac use. Coming to non-cardiac use, very simple, non-cardiac. Can you repeat, doctor? What are the important non-cardiac uses? Already something we studied. Can you please answer? Come on. Non-cardiac uses as a smooth muscle relaxant, we discuss. Useful for something called, yes, biliary cholic pain, achalasia cardia. So useful for biliary cholic pain. Number 2, achalasia cardia. These two properties, these two uses are due to smooth muscle relaxing property. But you should also know nitrate having one more important use, useful for treatment of cyanide poisoning. Useful for treatment of cyanide poisoning. Here you should answer me. Come on. You have very good knowledge in pharmacology. Can you please answer? Can you interact with me? Come on. By what property? By what mechanism nitrate useful for treatment of cyanide poisoning? Can you please answer? The biliary cholic use and achalasia cardia use. These two uses are based on smooth muscle relaxing property. Whereas my question, how they useful for cyanide poisoning? It is by, very good, it is by forming methemoglobin. Note. Nitrate useful for treatment of cyanide poisoning. It is by forming methemoglobin. By having methemoglobin. Very good. Now, just I will take 1 minute time to explain how the methemoglobin useful for treatment of cyanide poisoning. Just 1 second, I will explain. Okay, look here. Each and every cells of our body, all the cells in our body having one enzyme called cytochrome oxidase enzyme. Each and every cells of our body having cytochrome oxidase. This enzyme actually involved in cellular respiration. It is biochemistry MCQ. Which is the enzyme involved in cellular respiration? Answer, cytochrome oxidase. Now question, what happened to this enzyme in case of cyanide poisoning? This is what? Pharmacology. In case of cyanide poisoning, the cyanide causes chelation. That is chelation. They cause chelation of cytochrome oxidase enzyme. Look here. When cyanide chelating this enzyme, there is no chance for cellular respiration. That means cell going for hypoxia. That means cell going for death. It is a problem in cyanide poisoning. It is a pathology. For treating this poisoning, I am going to use nitrates. I am going to use nitrate. For example, come on, how to treat cyanide poisoning? For treating this poisoning, I am going to use one drug called amyl nitrates. Now look at the point. When I go amyl nitrates, the nitrate having the property of forming methemoglobin. Okay, one of the side effect of nitrate is formation of methemoglobin. Now question, the cyanide having more affinity, come on, having more affinity towards methemoglobin. So when they have more attraction towards methemoglobin, the cyanide will go towards methemoglobin and forms cyan methemoglobin, and they're going to form cyan methemoglobin. Now the point what you should know, when the cyanide attracted towards methemoglobin, this enzyme is escaped from cyanide. When this escape cyanide means this is going to involve in cellular respiration and cell death is prevented. That's the concept. So whenever there is methemoglobin, the cyanide will be attracted towards methemoglobin, and they are going to form cyan methemoglobin. When cyanide attracted towards mean, this enzyme is escaped from cyanide, thereby involved in cellular respiration. Now they are going to form cyan methemoglobin. Now what happened to this product? For this, what I do, I am going to give one more drug called sodium thiosulfate. When I give this drug, this is going to form sodium thiocyanide. Thereby the drug getting excreted. They get excreted from the body. So the concept what you need for MCQ, how nitrate useful for treatment of cyanide poisoning? Mean answer is by formation of methemoglobin. That's all. Okay. So we know cardiac use mean angina, MI, congestive cardiac failure, and for hypertension. Non-cardiac mean think of biliary colic, acrocardia, and cyanide poisoning. Finally, we go for adverse effect. What are all the important adverse reactions of nitrate? Come on. As a vasodilator, one of the most common problem MCQ, one of the most common adverse effect is headache, throbbing headache. That's the most common adverse effect. Next problem, as a vasodilator, nitrate may cause hypotension. Look here, whenever there is a hypotension, to compensate the hypotension, reflexly sympathetic system getting activated, sympathetic activation that may causes reflex tachycardia. So hypotension with the reflex tachycardia. Here one important point you should know, the reflex tachycardia is due to reflex activation of sympathetic. Come on. In the myocardium, we have sympathetic receptor like beta 1 receptor. The sympathetic beta 1 when activated, they cause reflex tachycardia. Now question starts. Whenever there is a tachycardia, the patient will complaining of palpitation. So my question starts. To control the palpitation, nitrate may cause hypotension with the reflex tachycardia. So to control the reflex tachycardia, I have to use nitrate along with the beta blocker. This is MCQ. The question, what is the reason? What is the reason for adding beta blocker with nitrates? Please note the reason for adding beta blocker with nitrate to prevent to prevent reflex tachycardia, to prevent palpitation. That is important MCQ. You must know. Okay. Next point. I told already, when you give nitrates continuous administration, there is a risk of development of tolerance. This I told already. Okay. Another problem, nitrate may cause side effect of methemoglobin. Come on. Methemoglobin is the adverse effect. But can you please repeat? This adverse effect exploited for the use of what condition? Nitrate causing adverse effect of methemoglobin. But the methemoglobinemia is adverse effect that was utilized for treatment of cyanide poisoning. Okay, that's important. Okay, finally, nitrate may also cause skin rashes problem. Can you repeat, doctor? I want to check your level of memory power. Can you please answer? All nitrate may cause skin rashes, but I told which nitrate causing maximum chances of skin rash? I told all nitrate. Maximally, pentaerythritol tetranitrate. I told you. Okay. So it's about adverse effect. And finally, one more point you should note down. That one more point is look here. Look at this slide. Man survived earthquakes, experienced the horrors of illness, all the tortures of the soul, but the most tormenting tragedy of all time, and all will be tragedy of the bedroom. That mean erectile dysfunction. Now one question I want to ask. Look here. Suppose this patient is already on nitrate therapy. Imagine. And he now having erectile dysfunction. For this he is consulting what? Sir, already on my nitrate therapy. Recently I developed erectile dysfunction. Shall I take sildenafil? What is the answer? If a patient is asking, come on, sir, already on nitrate therapy. Now I have, due to aging or due to some other problem, I developed a erectile dysfunction, sir. Shall I take sildenafil? He is asking me, what is the answer? Sildenafil and nitrate should not be taken together. This is important. Nitrate, sildenafil should never be taken together because of risk of severe hypotensive shock. Okay, that point is very important. Recently asked the question, actually you must know. Okay, and the last one more point, we have a new drug called molsidome. When you talk about nitrate chapter, you should know one new drug called as molsidome. Okay, the molsidome also acting by releasing nitric oxide, causing vasodilatation. It's a long-acting drug, so useful for prophylaxis of angina. Just note molsidome. What is molsidome? It's a longer-acting nitrate preparation. Okay. So look here. As a demo, I just mentioned only what is the pathology of angina and what are different types of angina and what are the drugs available. That is classification of anti-anginal agents. And then as a demo, I just explained one module that is called nitrate chapter. Actually, in my regular class, I will teach same way everything about beta blocker, then CCB, then I go for nicotindil, a potassium opener, and then I go for funny current sodium blocker like ibabradine, and then I go for antioxidant like trimetazoline, ranulozine. Like that, each and everything will be discussed completely without omitting any point. Okay, I go basic pharmacology, I go clinical point, I go MCQ point, everything I will revise. Okay, but one thing before finishing this session, I want one more thing. This is what some summary points. Look here. For treatment of angina, I have lot of drugs, doctor. But according to Goodman and Gilman textbook, you should know what are all the first line drugs for angina. Look here. The first line drugs useful for treatment of angina includes, start writing, number 1, beta blocker. Next will be CCB like diltiazem. and third will be nitrates. So remember, the first line drugs useful for treatment of angina includes beta blocker. That's the most important group of drug. And then CCB like diltiazem, and third will be nitrate. Whereas the second line drugs useful for treatment of angina includes, what are they? The remaining drugs. What are the remaining drugs? For example, PFOX inhibitors, that is pathway of fatty acid oxidation blocker. Pathway of fatty acid oxidation inhibitor like trimethazidine and leucine. Then IF, funny current sodium blocker like ivabradine, and potassium opioid like nicotindil. All these are second line drug useful for treatment angina. Here one question I want to ask. Look here. I told angina can be stable or unstable or vasospastic. Look here. Vasospastic angina. Vasospastic angina is also called variant angina. It's also called variant angina. Also called Prince metal angina. Anybody want to say? For a vasospastic angina, will you give propranolol? Will you give propranolol? Can you please answer? For treating a vasospastic angina, will you give propranolol, a beta blocker for treatment angina? See, beta blockers are contraindicated. The two non-selective beta blockers are contraindicated because remember, non-selective beta blocker causing vasoconstriction. Non-selective beta blocker causing vasoconstriction. So they are not good for vasospastic angina. For vasospastic angina, we go for either diltiazem or we go for nitrates. So CCB and nitrates are a good choice for vasospastic angina. And then doctor, one more thing today you should know. Look here. The same way I will discuss in class, doctor, remain right. I just one more sample. Look here. When you talk about MI, there are two different type of MI, doctor. One is called ST elevation MI. One more thing, non-ST elevation MI. There are small difference in the treatment. Look at the ECG. Here in V1, V2, V3, V4, there is a ST segment elevation. It's an acute ST elevation MI. Okay. Now the question starts. For MI, outline the treatment for MI. What are all the therapy useful for MI mean? First, this patient having severe chest pain. In MI, severe chest pain. For relieving the chest pain, I will give sublingual nitroglycerin. And also I give morphine. Morphine is a opioid, a very good painkiller, a fantastic drug for treatment of acute pain in MI. In this case, I want to ask one interesting question. Come on. Medico aspirant, Shubha, Gushbu, Anjali, Akhilesh, all of you please answer. But opioids are very good for relieving pain in MI. Now question. Name some opioid. Even though opioids are painkiller, can you please answer? Name some opioid which are contraindicated for treating pain in MI patient. Come on. Name some opioid. Even though opioids are analgesic, some opioids are contraindicated for treating MI pain. Who are they? That and all, pethidine and pentazocine. Please note, this is MCQ. Pethidine, one more drug, pentazocine. Both the drug may cause tachycardia problem. When the drug causes tachycardia, they are going to increase cardiac workload, thereby increasing oxygen demand. That means they will worsen angina. They may worsen the angina problem. So remember, the opioid of choice for treating pain in MI patient is morphine. But don't use pethidine or pentazocine. Pethidine and pentazocine, even though opioid painkiller, they are causing tachycardia, thereby going to worsen angina. So they are contraindicated in MI patient. So that's called pain relieving by nitrate and by opioids. Second point, MI is due to block in the coronary artery. Look here. Whenever there is a block in the artery, most of the time the thrombus. The thrombus in the artery means mainly formed by platelets. Platelets are the main thing causing obstruction in the artery. So, to relieve the obstruction, I need antiplatelets. So, for treating MI pain, we give nitrates and then morphine, but don't use this. And we have to use antiplatelet like aspirin, clopidogrel. That is very important, very important. Apart from that, we can do thrombolysis. The thrombus can be lysed. That is called recanalization. We can do recanalization. The recanalization done by either medical method or by surgical intervention. Surgical intervention means we can go for PTCA, angioplasty, percutaneous transluminal coronary angioplasty. Medical therapy means we go for thrombolytic like streptokinase or urokinase or altiplase. All these are different topic. I will discuss separately after some time. Okay. Now, the recanalization can be done by either PTCA, percutaneous transluminal coronary angioplasty, or by medical method called thrombolytic therapy. Okay. Apart from that, we have to use anticoagulant and then controlling diabetes, controlling hypertension. All these are supportive therapy. Controlling cholesterol, all are supportive therapy. But one point I want to tell, look here, the treatment for ST elevation MI and for non-ST MI same, almost same, except one thing. What one thing? In non-ST MI, the treatment almost same, except what? In non-ST MI also we give painkiller, we give antiplatelet, we can do PTCA, but don't use thrombolysis. In non-ST MI, there is no role for thrombolysis. The thrombolytic therapy causing more bleeding, more adverse effect, benefits are less. So, same treatment except thrombolysis. This is MCQ. Thrombolytic therapy not giving adequate benefit in non-ST MI. Okay. Finally, one more point actually. See, I told supportive therapy, treatment of diabetes, treatment of hypertension, treatment of cholesterol, all these are important. Okay. Last point, when you talk about PTCA, interesting question, look here. Imagine this patient having some block in the artery. I decided to do PTCA, percutaneous transluminal coronary angioplasty. Here question, even after doing angioplasty, there is a chance of restenosis. There's a chance of restenosis. To prevent this, we put one stent. Okay. In the stent, we are adding some drug. That's called drug-eluting stent. Drug-eluting stent. Now, the question goes to all people. Can you please answer? When you talk about drug-eluting stent, my question, name some drug useful for adding on the stent. One is very good. Come on, answer. I want drug name. Drug name, sirolimus. One more drug, paclitaxel. Very good. So, the drug-eluting stents are prepared by using either sirolimus or by adding with the paclitaxel. See, actually the sirolimus is an immunosuppressant. It's a mTOR inhibitor. This and all separate topic I will discuss later on, immunosuppressant chapter. Sirolimus, one of the immunosuppressant, can be added in the stent. And the immunosuppressant causing what problem? The two most important side effects, it may cause thrombocytopenia and hypertriglyceridemia. They cause thrombocytopenia and hypertriglyceridemia, TGL. And then paclitaxel, what is this? Actually, it's an anti-cancer drug. This drug causing side effect of very important. They causes peripheral neuropathy and myelosuppression. Okay. And finally, come on. Last point important. Even though we do PTCA, even after doing PTCA, you must put antiplatelet. Even after PTCA, you have to put the patient on dual antiplatelet. Usually we go for aspirin with the P2 Y12 blocker like clopidogrel. Okay, so aspirin plus clopidogrel is very important. They must be given. Okay, even after using angioplastic technique, we have to put the patient on antiplatelet like aspirin and clopidogrel. That finishes how to manage the case of acute MI by thrombolytic therapy or by angioplastic technique. Okay, doctor. So either we can go for clopidogrel or prasugrel or ticagrel, or all these are P2 Y12 blocker. It's a separate topic. I will discuss later on. Okay, we have one good topic called antiplatelet, separate topic, where we have low dose aspirin therapy, P2 Y12 blocker like clopidogrel, prasugrel, ticagrelor, gangrelor, like that, and then glycoprotein 2B3A blocker like abciximab, FT5-batide, tyrifibin. Lot of drugs are there that I will discuss later on. Okay, now as a demo session, the given time 1 hour. Okay, I just want to tell something in this 1 hour main. I have finished one thing called types of various angina, pathology behind the angina, and what are all the important anti-anginal drugs classification. In that I discussed nitrates in detail, and then we discussed about how to manage a case of MI, outlining the drug therapy useful for MI. Okay, I think this session may be benefit for you. Okay, definitely from this year, definitely going to have one question. So read well, doctor. All the very best. Thank you. When you attend my regular class, that will be energetically will be enjoying. All with the super mnemonic, super creativity will go in my regular class. So all the best. Do well. Thank you. All the best.